One of the challenges in transcatheter therapies focused on the tricuspid valve is there's a wide spectrum of different etiologies, causes for the disease in the tricuspid valve, with a wide range of issues as it relates to that. So it's not a very homogeneous population. There's a lot of heterogeneity to it, and therefore we need to have a wide or wider range of therapies that we can individualize for a person's given amount of tricuspid regurgitation. And that is also complicated by the fact imaging of the tricuspid valve is more complicated. The aortic and mitral valves are on the left side of the heart, which is in line with our esophagus, our swallowing tube, which is the primary modality, how we image through transesophageal echocardiography. So offline imaging of the tricuspid valve is that much more challenging. Plus, the tricuspid valve is intimately connected to the right side of the heart, the right ventricle, the pulmonary artery, and so forth. And we can't quite separate those things out. We're also trying to better understand the right side of the heart, the right ventricle, its performance or impairment in disease processes. And our understanding of all of that together is at just a very rudimentary stage. And of course that then adversely impacts our ability to provide therapies for the tricuspid valve. So the current therapies, number one is medicines, diuretics, to remove the fluid and therefore improve the symptoms, but only does it a little bit and it doesn't treat the underlying issue. Number two is surgery, open heart surgery to repair or replace the valve. However, with that, surgery is not done very frequently for this, and it's been known historically to have a very high mortality rate with surgery. So as a result, we're looking for novel therapies because there's clearly a big unmet need. And those novel therapies are transcatheter ones. Patients with tricuspid regurgitation, once they come to our attention, they usually are quite symptomatic with fluid buildup that is occurring to them despite medical therapy. And these patients are very high risk to go on to open heart surgery. So they're desperate to look for some alternative that'll help them live better without a high risk that's associated with it. So we're actively looking at clinical research trials at devices to repair the leaking tricuspid valve by various types of clips to go after the leaflets of the tricuspid valve and bring them closer into apposition, thereby decreasing the degree of the leakage from the valve. We're also looking at therapies that place rings around the outside of the tricuspid valve to shrink it down. And lastly, we're even looking at ways through a transcatheter approach to completely replace the tricuspid valve with a new valve. So I think this will be a toolbox-like approach where, depending on the patient's needs, we have the right technology, the right therapy for that given patient.